education in mental health and mental health self-care is of utmost importance in the school and also later in life for deaf people and their families, to help them to cope and to build resistance against illnesses, psychiatric illnesses, mental health illnesses and issues. And the way that is necessary to go is to have more deaf facilitators and educators. More deaf people qualified in the profession so that they can have a deaf-to-deaf approach in giving all information but also counseling. Many times it is that deaf people do not have access to therapists and counselors that's fluent in sign language. So deaf students in mental health professions need to be promoted to make sure that more deaf people enter the profession of mental health and deafness. Organizations working in the deaf field and deaf services field should prioritize in their budget also for deaf people to be trained as mental health professionals. And that is very important in the whole deaf environment for all organizations involved with services to the deaf to support this and to make this possible. Sadly, through years. As long as there is no equal access to information, that will be the case. The comparison between deaf and hearing in this respect is unfair. Because deaf people don't have the same access to information and knowledge than the hearing and the general community. A deaf-to-deaf approach will help to alleviate and even remove this disparity between deaf and hearing people in terms of knowledge and understanding of mental health. I think for a deaf person, it is necessary to have contact with himself, with his own emotions and thoughts and behavior, to evaluate it. And if he or she sees that it is more than normal, the type of behavior that is not acceptable, the feelings, the thoughts, sometimes the aggression, disruptive behavior, and also feedback from his or her own environment shows that it is not normal, then this person should be willing to seek help. The first will be to go to your family and your loved ones, to talk to them and to your friends, people you can trust, people that will support you, and talk to them. And if this does not help, or you feel not satisfied, or perhaps you don't want to go to them and talk about it, then it is necessary to go to a pastor and be honest and open. Also, go to your medical doctor, the general practitioner, and talk to him openly, honestly, about what you see in yourself and how you evaluate your own behavior and your feelings and your thoughts. And show a willingness to consult the psychologist and the psychiatrist It is necessary for you to take action and do something. When it is a case of severe depression, it will be difficult. But it is necessary to listen to the people around you and also take their advice and go out and do something. Mental health is one of the most precious qualities that we have. Of our most precious priorities that we must follow and that we must look after and care for. Don't give up. Go, get out and persist in seeking help until you get the right help that can help you on the way forward. And that brings us to mental health, self-care. This is important. We often talk about this self-care, your body, your health and so on, but not your mental health. And that is very important, that you also take care of your mental health. There must be also self-care. If you have a prescription or medication for your illness, please take it as prescribed. Don't use other medication. Don't self-medicate yourself. And when you got this medication from the doctor or the psychiatrist, please give feedback to him or if it is not working well. You are the person that is experiencing it. You are the person that must give feedback. If it is working well, also give feedback, so that there can be a strengthening of the medication and see if there should be an increase or decrease of medication. This will help the doctor, the psychologist and the psychiatrist a lot if you can do that. And then sometimes what happens with deaf people is that they go on for too long a period with the same medication. There should be evaluation. There should be at least annually a visit to the doctor to do a routine examination. And you must always remember that this illness, this mental illness, is also a medical illness. Like any other illness, it has a medical, a biological origin. And this is why you must take medication. It is not a sign of weakness to take medication for mental health illnesses. It is a necessity, the same as you would take medicine for a physical illness that you go to the doctor for. And also don't use other drugs and other medicines, especially not drug abuse, illegal drugs. Be very careful also for alcohol, and definitely not alcohol abuse. Don't do self-medication, because it can interfere with your medication and it will have a very negative influence of your mental health. And then follow a healthy routine. Get enough sleep. 8 hours a day is good for body, spirit and brain. Eat healthy and a balanced diet, meals. Exercise. People don't realize how important exercise is when you're suffering from depression. Exercise at least 30 minutes a day. Don't overdo it. It's not heavy exercise that you need. But it is important to, for instance, do walking. Walking is one of the most appropriate ways also to maintain mental illnesses and issues. If you do that 30 minutes a day, you can do more, but don't overdo it. And sometimes you will not be feeling to do it. You will feel now, not now, tomorrow. Please don't give in. Get up and do it. It's not going to be easy sometimes, but get up and do it. The other thing is, get a hobby that you like, not that is boring to you. And if the circumstances allow it, and you love animals, get a pet. It can be a bird, a dog, or cat, and then take good care of them. Give them a healthy and happy life. That will also change your thoughts and your minds and your feelings. If you have a garden, do some gardening. Perhaps you have a small place. Start doing your vegetables and your herbs in holders, in pots, and care for them. The other thing is, don't isolate yourself. Socialize. It's not going to be easy. Sometimes you won't feel like it. But discipline yourself, because afterwards you will feel better. Remember always to ask for help. Don't be too proud. Don't have resistance. Don't start saying, I can do it myself. Acknowledge when you cannot do it yourself and ask for help. Remember, if you do that, you will get stronger, and sometime in the future, somebody will come to you in need, and you will be able to help this person. And lastly, join a faith community. A faith community where you can develop yourself spiritually and strengthen your faith. In your daily routine, make time for meditation and prayer. Make time to be with yourself. Make time to strengthen your inner resources. This will make you stronger and spiritually more healthy, and to help you also to help yourself, and to be a benefit and a blessing for other people. Back to yourself. Explore your talents and use them for self-development. Start doing services to other people, help other people. And also look at entertainment that's appropriate for you, that's good for you. And go out and enjoy life. You have only one life. Enjoy it to the fullest.